falling back asleep has become harder after 75. Here's what you should know. Research suggests that persistent sleep difficulties become more common with age, but the reasons behind them are often more complex than many people realize. While sleep naturally changes as we grow older, repeatedly waking during the night and struggling to fall back asleep shouldn't automatically be dismissed as just aging. In many cases, there are manageable causes behind this common problem. Point 1. An overactive mind. Stress, worry, or racing thoughts often become more noticeable in the quiet hours of the night. Once your brain becomes fully alert, returning to sleep can be surprisingly difficult. Relaxation techniques and a consistent bedtime routine may help. Point 2. Alcohol before bed. Alcohol may make you feel sleepy at first, but it often disrupts sleep later in the night. As its effects wear off, many people wake up and struggle to fall asleep again. Point 3. Frequent nighttime urination. Getting up to use the bathroom becomes more common after 75. Repeated interruptions can break your sleep cycle and leave you wide awake after returning to bed. Point 4. Chronic pain, arthritis. Back pain and other chronic conditions may become more noticeable during the night. Even mild discomfort can make relaxing enough to sleep much harder. Point 5. Medication side effects. Some prescription medications, including diuretics and certain stimulants, may contribute to nighttime awakenings. Never stop a medication without first speaking with your healthcare provider. Point 6. Sleep apnea repeated. Pauses in breathing during sleep may cause frequent awakenings. Even if you don't remember them, loud snoring or daytime fatigue may be important clues. Point 7. An irregular sleep schedule. Going to bed and waking up at different times each day can confuse your body's internal clock, making it harder to maintain restful sleep. Point 8. Too much caffeine, coffee, tea, chocolate, and some soft drinks consumed later in the day may continue, affecting sleep for hours, especially in older adults. Point 9. Long afternoon naps. Long naps may reduce your natural sleep drive, making nighttime sleep lighter and more fragmented. Point 10. An uncomfortable bedroom. A room that's too warm, too cold, noisy, or overly bright can interrupt sleep throughout the night. Point 11. Heartburn. Acid reflux may become worse while lying down, causing discomfort that wakes you unexpectedly. Point 12. Lack of physical activity. Regular daytime movement supports healthier sleep. Spending most of the day inactive may make nighttime sleep less refreshing. Point 13. Changes in your internal body clock. As we age, our circadian rhythm naturally shifts. Many adults become sleepy earlier in the evening and wake earlier in the morning. Sleep also becomes lighter, making it easier for small noises, discomfort, or bathroom trips to interrupt the night. While these changes are common, persistent difficulty, falling back asleep, should still be discussed with a healthcare provider if it affects your daily life. Point 14. Underlying health conditions. Sometimes interrupted sleep is a symptom rather than the main problem. Conditions such as diabetes, heart disease, thyroid disorders, depression, anxiety, or lung disease may contribute to nighttime awakenings. Because many of these conditions can be treated or managed, it's important not to ignore persistent sleep problems, especially if they are accompanied by other symptoms. Point 15. Know when to seek medical advice. Occasional restless nights happen to everyone. But if you're regularly unable to fall back asleep, feel exhausted during the day, or notice symptoms such as loud snoring, breathing pauses, chest discomfort, or frequent nighttime urination, it's a good idea to speak with your healthcare provider. Identifying the underlying cause may help improve both your sleep and your overall health. Point 16. Restless leg syndrome. Some older adults experience an uncomfortable sensation in their legs. Just as they're trying to relax or fall asleep, it may feel like tingling, crawling, itching, or an irresistible urge to move. These sensations often improve temporarily with movement, but return once the person lies still again. As a result, even after waking briefly during the night, the discomfort can make falling back asleep extremely difficult. If these symptoms occur regularly, a healthcare provider can help determine whether restless leg syndrome or another condition is contributing to the problem. Point 17. Too much screen time. Before bed, watching television or using a smartphone, tablet, or other electronic device shortly before bedtime may interfere with healthy sleep. For some people, bright light from screens can reduce the production of melatonin, the hormone that helps regulate the sleep-wake cycle. In addition, reading news, checking emails, or scrolling through social media may stimulate the brain instead of helping it relax. Creating a calming bedtime routine without electronic devices may support better sleep quality. Point 18. Dehydration. Even mild dehydration can become more common with age because the sensation of thirst often decreases. Dry mouth, muscle cramps, or general discomfort during the night may increase the likelihood of waking up. At the same time, drinking large amounts of fluid just before bed may increase nighttime trips to the bathroom. Finding a healthy balance by staying hydrated throughout the day while limiting excessive fluids close to bedtime may help reduce unnecessary sleep interruptions. Point 19. Depression. Depression doesn't always appear as persistent sadness. In many older adults, it may show up as changes in sleep, reduced energy, loss of interest in enjoyable activities, or waking much earlier than usual. Difficulty falling back asleep after waking during the night can sometimes be one part of a broader pattern. Because depression is a medical condition that can often be treated, it's important to seek professional help if sleep problems occur alongside lasting changes in mood or daily functioning. Point 20. Anxiety disorders. Occasional worry is a normal part of life, but persistent anxiety can make the mind remain alert, even when the body is tired. After waking during the night, anxious thoughts may quickly take over, making it difficult to relax enough to return to sleep. Learning stress management techniques, maintaining healthy daily routines, and seeking professional support when anxiety becomes overwhelming may significantly improve sleep quality. Point 21. Don't ignore persistent sleep problems. Waking up occasionally during the night is common, especially after age 75. However, consistently struggling to fall back asleep for weeks or months isn't something you should simply accept as part of aging. Persistent sleep problems deserve attention because they can affect memory, mood balance, energy, and overall quality of life. If your sleep difficulties continue despite healthy sleep habits, or if they occur along with other concerning symptoms, speak with your healthcare provider. Finding and treating the underlying cause may help you enjoy more restful nights and healthier days. When it's time to talk to your healthcare provider, occasional difficulty falling back asleep happens to almost everyone and usually isn't a cause for concern. However, if this problem occurs several nights a week, continues for weeks or months, or leaves you feeling tired, forgetful, or less able to enjoy daily activities, it's important to discuss it with your healthcare provider. A medical evaluation may help identify underlying causes, such as medication side effects, chronic pain, sleep disorders, or other health conditions that can interfere with restful sleep. In many cases, appropriate treatment or simple lifestyle adjustments can improve sleep quality. Better sleep supports memory, physical health, emotional well-being, balance, and independence, making it an important part of healthy aging.